Hello students, today's topic is axial skeleton. The skeleton in total consists of bones, cartilages, joints and ligaments. The skeleton is made up of 206 bones named bones grouped into the two divisions. First one is the axial skeleton containing 80 bones, while the other type of skeleton is appendicular skeleton, or division of the skeleton is appendicular skeleton, which is consisting of 126 bones. Coming on to the axial skeleton, it is formed up of 80 bones. It consists of skull, vertebral column and thorax. Bone markings are the projections that provide the attachment for the muscles and ligaments. These projections help form joints and depressions and openings for passage of nerves and blood vessels. The skull is formed or is divided into cranial and facial bones. So in this diagram you can see cranial and facial bones. The cranium serves to enclose the brain, or it is the place where the brain is situated. It provides the attachment for the sides of some head and neck muscles. Face or the facial bones serve to frame the bone of face or form the framework of the face. They form the cavities for the sense organs of sight, taste and smell, that is eye, tongue and nose. They provide the openings for the passage of air and food. They also hold the teeth in place. They also act as anchors for the muscles of face. Facial bones form the anterior aspect, while cranium is divided into cranial vault and the base. Internally, prominent bony ridges divide the skull into the distinct fossae. The skull contains smaller cavities such as middle, inner ear cavities, nasal cavity, orbital cavities, and air-filled sinuses. Middle and inner ear cavities form the base of the cranium. Nasal cavities, wherein the nose or structure of the nose lies. Orbital cavity houses the eyeballs, while air-filled sinuses are present in the bones or several areas of the nasal cavity. Skull consists of approximately 85 openings, which include foramens, canals and fissures. They provide opening for some important structures like spinal cord, blood vessels and 12 pairs of cranial nerves. Cranial bones, they are 8 in number. They are 8 large bones. There are some bones which are paired, for example temporal bones and parietal bones, which are 2 in number each. There are unpaired bones which include frontal bones, occipital bones, sphenoid and ethmoid, which are 1 in number. Frontal bones. Frontal bone form the forehead and the roof of the orbit or orbital cavity and form the superciliary arches. Internally, it contributes to the anterior cranial fossa. It also contains frontal sinuses. Parietal bones and sutures. Parietal bones from the superior and the lateral parts of the skull. 4 sutures are present in the cranium, which include coronal suture, which runs in the coronal plate, which is located where parietal bones meet the frontal bone. That is, it is a suture or joint between the frontal bone and the two parietal bones. Second suture is squamous suture. This occurs where each parietal bone meets a temporal bone inferiorly. That is, this suture is joint between the parietal bones and the temporal bones. Sagittal suture, which is the suture occurring where the right and left parietal bones meet superiorly. That is, this suture is a joint between the parietal bones. Next is lambdoidal suture. It is a suture which occurs where parietal bone meets the occipital bone posteriorly. That is, it is a joint between the parietal bones and the occipital bones. Sutural bones. Sutures are nothing but the joints which are present between only the bones of the skulls. These Sutural bones are the small bones that occur within the sutures. They are irregular in shape, size, and location. Not all people have sutural bones. The skull posterior view, wherein you can see the sagittal suture, which is dividing the two parietal bones, or which is joining the two parietal bones. Next is the lambodal suture, which is helping in articulation of the parietal bone with that of the occipital bone. Occipital bone, it forms the posterior portion of the cranium and the base of the cranium. It articulates with the temporal bone and the parietal bone. It forms the posterior cranial fossa, and foramen magnum is located at the base. Occipital bone consists of some structures like occipital condyle, hypoglossal foramen, external occipital protuberance, and superior nuptial lines and inferior nuptial lines. So here you can see at the center foramen magnum and the other structures like parietal bone, occipital bone, sphenoid, ethmoid, and some bones of face like maxilla, mandible, palatal bone, sphenoid bone, vomer, etc. Temporal bones, they lie inferior to the parietal bones, form the inferolateral portion of the skull. This comes from the Latin word time, that is temporal. Specific regions of the temporal bones include squamous, temporal, petrous, and mastoid regions. This is the lateral aspects of the skull, wherein you can see the different bones of the skull, that is the cranium and face. This is the structure of axial temporal bone, which is situated at the sides of the skulls. Sphenoid bone, it spans the width of the cranial forms, resembles a butterfly or a bat. It consists of body and 3 pairs of processes. It contains 5 important openings. So this is a butterfly shaped structure of the sphenoid bone. This is a posterior view of the same. Next is ethmoid bone. This bone lies between nasal and sphenoid bone. It forms the most of the medial bony region between the nasal cavity and the orbits. So this is the anterior look of the ethmoid bone, which is present at the nasal region in between the two orbital cavity and upper portion of the nasal bones. So bones of the skull: 1 frontal, 2 parietal, 1 occipital, 1 ethmoid, and 1 sphenoid. Facial bones: there are some bones which are paired and some are unpaired. Unpaired bones include mandible and vomer, which are only 1 in number, where paired bones include maxillae, zygomatic bones, nasal bones, lacrimal bones, palatine bones, and inferior nasal concave bones, which are 2 in number each. Mandible, which is also known as lower jaw bone, is the largest and strongest facial bones. It is composed of 2 main parts, horizontal body and 2 upright rami. So here you can see the structure of the mandible, which consists of ramus, body of the mandible, and place for the articulation of tooth, coronoid process, and the temporal fossa for articulation with the temporal bone. Maxillary bones, which are the bones of the upper jaw. This articulate with the other facial bones except mandible. It contains maxillary sinuses. It is forming the large paranasal sinuses. This forms the part of inferior orbital fissure. These are the maxillary bone or bones of the upper jaw. Here you can observe the maxillary bone from the posterior view. Other bones of the face include zygomatic bone. These are forming the lateral walls of orbits. These are also known as cheekbones. Nasal bones, as the name itself indicates, they form the bridge of the nose. lacrimal bones are present in the eye sockets, which are located in the medial orbital walls. Palatine bone forms the roof of the oral cavity and complete the posterior part of the hard palate. Vomer forms the inferior part of the nasal septum, which divides the nasal cavity into two parts. Inferior nasal conchae, these are thin curved bones which project medially from the lateral walls of the nasal cavity. So these are the bones of face, wherein you will find zygomatic bone, lacrimal bone, vomer, mandible, inferior nasal conchae, lacrimal bones, zygomatic bones, vomer, etc. Special parts of the skull, which include orbits or eye sockets, nasal cavity wherein nasal structure is present, paranasal sinuses, and the hyoid bone. So this is the nasal cavity containing the nasal bones, inferior nasal conchae, and the sinuses. Nasal septum. This is the orbital cavity, which are also known as eye sockets. Paranasal sinuses are nothing but the air-filled sinuses which are located within the frontal bone, ethmoid, sphenoid, and the maxillary bones. These are again lined up with the mucous membrane and also serves to lighten the skull by filling the air in the cavities. So these are the sinuses or the air cavities wherein the air is filled. Hyoid bone. Hyoid bone lies inferior to the mandible. This is the only bone which is having no direct articulation with any other bone. It acts as a movable base for the tongue. Now, after the skull, the next part of the skeletal system is the vertebral column. Vertebral column, which is the next to that of the skull, in the axial skeleton. It is formed up of 26 bone in the adults. It transmits the weight of trunk to the lower limbs and surrounds and protects the spinal cord. This vertebral column is the place for the spinal cord. The spinal cord passes through the vertebral column. Vertebral column acts as attachment size for the muscles of the neck and back. It is held in the place by the ligaments. It forms the anterior and posterior longitudinal ligaments, also ligamentum flavum. This is the structure of the vertebral column. Vertebral column consists of intervertebral discs between the vertebrae, which are nothing but the cushion-like pads which are situated between the vertebrae. They act like shock absorber and they are composing 25% of the height of the vertebral column, which are composed of nucleus pulposus and annulus fibrosus. Nucleus pulposus consists of gelatinous inner sphere of intervertebral discs and enable the spinal cord to absorb compressive stresses. Annulus fibrosus is an outer collar of the ligaments and fibrocartilage which is consisting the nucleus pulposus. It functions to bind the vertebrae together, resist tension on the spine and absorb compressive forces. So they tend to protect the spinal cord from the pressure and the shock. In this diagram, you can see intervertebral discs which are associated with the ligaments. Herniated discs may be caused by trauma to the spine. Also, aging can be a factor for the same. Vertebral column is about 70 centimeters or 28 inches and the column is divided into 5 major regions. First one is the cervical vertebrae. There are 7 cervical vertebrae in the neck region. Then 12 thoracic vertebrae which are present in the thoracic region. Lumbar vertebrae It consists of 5 lumbar vertebrae present in the lower back region. Sacrum is inferior to the lumbar vertebrae, which is fusion of 5 bones and articulates with the coaxial bones or the pelvic bones. Coccyx, most inferior region of the vertebral column. It is made up of fusion of 4 bones. 4 distinct curvature give the vertebral column a S-shaped structure. So vertebral column is not a straight, but it is having S shape. So these curvature are cervical curvature and lumbar curvature. Cervical curvature is present in the curvature in the cervical region and are concave posteriorly, while lumbar curvature is present at the trunk or lumbar region. Thoracic and sacral curvatures, they are convex and they are present in the thoracic and sacral regions. Curvature increases the resilience of the spine. So here you can see the S-shaped structure wherein cervical and the lumbar are concave while the thoracic and sacral form the convex structure. So these are the general structures which are associated with the general vertebrae. So it consists of the central vertebral foramen wherein the spinal cord passes, and transverse process at the 2 sides and the spinous process in the middle region. Also it consists of facets for the articulation with the other bones. Regions or characteristics of the vertebrae. The specific regions of the spine perform the specific functions. Types of movements which are occurring between the vertebrae are flexion and extension. Lateral flexion, rotation of the long axis. Cervical bones. There are 7 cervical vertebrae, C1 to C7. Cervical vertebrae are the smallest and lightest vertebrae. C3 to C7 are typical cervical vertebrae. The body is wider laterally, spinous process are short and bifid. Vertebral foramen are large and triangular. Transverse processes contain transverse foramina. Superior articular facets face the supero-posteriorly. So here is the structure of the cervical vertebra, wherein central cervical or vertebral foramen is there, or spinal foramen is there, through which the spinal cord passes. It is having triangular structure. The spinous process is bifid, it is bifurcated into 2. At the sides, 2 transverse processes which are consisting of transverse foramina. So C1 or the first cervical vertebrae is called as atlas, while C2, which is second cervical vertebrae, is called as axis, while the remaining one are the typical cervical vertebrae from the C3 to C7. Atlas. Atlas is the first cervical vertebra which lacks a body and the spinous process, but it supports the skull, which is having facets for articulating with the occipital condyle of the occipital bones. It allows flexion and extension of the neck for nodding the head to say yes. So this is the structure of the first cervical vertebrae called as atlas, which consists of facets for articulation with the occipital bone, transverse foramens at the 2 sides, and the central vertebral foramen for the passage of the spinal cord. This is the posterior view of the same. Next cervical vertebra or second cervical vertebra is the axis. It has a bony and spinous process. It also has dense or odontoid process which projects superiorly. It forms the fusion of the body of the atlas with the axis. It acts as a pivot or the area for rotation of the atlas and the skull. It participating in the rotating the head from side to side or nodding the head to say no. This is the posterior view of the axis, which is having facets for the articulation, spinous process, and an axis in the middle. And it is also having the central canal for passage of the spinal cord. Next is thoracic vertebrae, which are 12 in number, that is T1 to T12. These acts as the place, these are articulating with the ribs at the facets where the ribs articulate with the thoracic vertebrae. They have heart-shaped bodies from the superior view, and each side of the body, T1 to T10, bears a demi-facet for articulation with the ribs. T1 has full facets for the first rib, while T10 to T12 have a single facet. So this is the general structure of the thoracic vertebrae. It consists of the heart-shaped body, the transverse processes which are two in number, central vertebral foramen or spinous foramen wherein spinal cord passes, and spinous process which is longer. Thoracic vertebrae consist of spinous process which are long and point inferiorly. They also contains vertebral foramen which are circular. Transverse processes are articulating with the tubercles of the ribs. Superior articular facets points posteriorly. Inferior articular processes point anteriorly. The movement which they allow are rotation and prevents flexion and extension. Next type of vertebrae include lumbar vertebrae, which include L1 to L5, that is 5 lumbar vertebrae. The bodies of lumbar vertebrae are thick and robust. Transverse processes are thin and tapering. Spinous processes are thick, blunt, and point posteriorly. Vertebral foramen are triangular in the structure. Superior and inferior articulate facets direct medially. They allow the movement, flexion, and extension. Rotation is prevented in that area. So this is the structure of a lumbar vertebrae, which consists of central vertebral foramen, triangular in structure, body is broad, spinous process and the transverse processes are short, and the facets are present for the articulation. So this is the way how the lumbar vertebrae are placed one over another. Next type of vertebrae are sacral vertebrae, which are actually 5 in number, but they are fused to form one. They shape the posterior wall of the pelvis. They have formed from 5 fused vertebrae. Superior surface articulates with the L5, that is 5th lumbar vertebrae, and inferiorly articulates with the coccyx or coccyx. It consists of sacral promontory, where the first sacral vertebrae bulges into pelvic cavity. Center of the gravity is 1 centimeter posterior to the sacral promontory. Sacrum consists of sacral foramina, which is the hole, ventral foramina for passage of ventral rami of the sacral spinal nerves, dorsal foramina for the passage of dorsal rami of the sacral spinal nerve. So this is the structure of the sacrum, anterior as well as posterior view, wherein you can see the different foramen, that is anterior sacral foramen, ridges, medial sacral crest, posterior foramina, etc. Coccyx, it is also known as tailbone. It is formed from fusion of 3 to 5 vertebrae. It is offering only slight support to the pelvic organ. After the vertebral column, the third portion of the axial skeleton is the bony thorax, that is the thoracic cage. It forms the framework of the chest. The components present in the thorax consist of thoracic vertebrae, which are present posteriorly, ribs which are present laterally, and sternum and costal cartilages which are present anteriorly. Bony thorax protects the thoracic organ. It also supports the shoulder girdle and upper limbs. It also provides attachment for the site of muscles. So this is the structure of bony thorax, which consists of ribs, sternum at the anterior side, while the vertebral column, that is thoracic vertebrae, at the posterior region. First 1 to 7 pairs of ribs are true ribs, while 8 to 12 pair of ribs are float ribs, false ribs. That is, next 3 pairs are false ribs, and the last 2 pairs are floating ribs. So this is the actual structure of the thoracic cavity or thoracic vertebrae. Sternum. Sternum is also known as chest bone, which is forming the three sections: manubrium, body or mesosternum, and third is xiphoid process. Manubrium is the superior section, which is also called as head of the sternum. It articulates with the medial ends of the clavicles, forming sternoclavicular joint. Next is body or mesosternum, which is forming the bulk of the sternum. It is having notches for the articulation of costal cartilages of ribs 2 to 7. Xiphoid process. It is also known as the tail of the sternum, present in the inferior end of the sternum. It ossifies around the age 40. Sternum also consists of anatomical landmarks such as jugular notch, that is the central cavity or indentation at the superior border of the manubrium. Sternal angle, a horizontal ridge where manubrium joins the body. Ribs. All the ribs attach to the vertebral column posteriorly, and anteriorly they attach to that of the sternum with the costal cartilage. True ribs, they are 7 pair of ribs which attach the sternum through costal cartilages directly. False ribs are the inferior 5 pair of the ribs which are not directly attached to the ribs. They are attached to one another and they are attaching to the sternum. Ribs 11 and 12 are known as floating ribs because they are just attached to the posteriorly to the vertebral column and floating at the anterior region. Skeleton. It consists of bones, cartilages, joints and ligaments, and appendicular skeleton consists of 126 bones and axial skeleton consists of 80 bones. This is the structure of rib, which is articulating at the posterior region with that of the vertebral column, that is thoracic vertebrae. In anterior region it is having costal cartilages which is attaching to the sternum. So here is the structure and the articulation of the rib with that of the thoracic vertebrae. So these are the structures which are associated with the axial skeleton. Disorders of the axial skeleton: abnormal spinal curvature, which is also known as scoliosis, that is abnormal lateral curvature; kyphosis, that is exaggerated thoracic curvature; lordosis, that is accentuated lumbar curvature, which is also known as swayback; stenosis of lumbar spine, which is nothing but the narrowing of vertebral canal. Axial skeleton. Membrane bones begin to ossify in the second month of the development. Bone tissue grows outward from the ossification centers. Fontanelles are the structures which are unossified remnants of the membrane, which are usually present in the newborn babies. These are the different fontanelles. Many bones of the face and skull form the intramembranous ossification. Endochondral bones of the skull form the occipital bones, phrenoid, ethmoid, and parts of the temporal bones. Curvature of the vertebral columns. Primary curvature: an infant spine is C-shaped at the birth. Secondary curvature, cervical and lumbar curvature, develop when a baby begins to walk. Distribute the weight of the upper body over the lower limbs. Aging of the axial skeleton: water content of the intervertebral discs decrease after the age of 55. Loss of few centimeters of the height is common. Thorax becomes rigid. Bones lose the mass with the age. So here we finish the axial skeleton. Thank you.